This educational clinical video presentation is brought to you by the Department of Surgery of the Chinese General Hospital and Medical Center. Today, we will present colorectal cancer, its signs and symptoms, diagnostic procedures, and treatment. According to the World Health Organization, cancer is one of the leading causes of morbidity and mortality worldwide. Specifically, colorectal cancer is the second most common cause of cancer deaths, amounting to about 935,000 deaths in 2020. According to our local data here in the Philippines, colon cancer is the third leading cause of morbidity and mortality overall. Colorectal cancer is consistently among the top 3 most common types of cancer in both sexes. Colorectal cancer, one of the most common types of cancer in the world, is defined as an unrestricted overgrowth of cells within the colon and rectum, which may eventually lead to the spread of cancer cells to other parts of the body. Older populations are more typically affected by this cancer. However, colorectal cancer may still occur at any given age. Colorectal cancer typically begins as an abnormal growth within the colorectal lining. Abnormal growths will start out as benign overgrowths of the colorectal lining with stalks termed as polyps. These benign overgrowths over time will eventually start to continue to enlarge until the cellular mechanisms begin to acquire the propensity to invade adjacent tissues, resulting to what we know as cancer. The most common signs and symptoms of colorectal cancer will include the following constitutional symptoms, such as unexplained weight loss, weakness, chronic fatigue, pallor or anemia, and unexplained fever. Aside from the systemic symptoms, colorectal cancer may present with local abdominal symptoms, including changes in bowel habitus, defined as bouts of alternating constipation and diarrhea, presence and persistence of small goat-like stools, findings of blood in the stool characterized as fresh blood or black tarry stools. Sometimes, cancer may cause obstruction in the lumen. The resulting increase in pressure may cause the bowels to distend, resulting in bloating, severe abdominal pain, persistent vomiting, and anorexia. If untreated immediately, the colon may perforate, resulting in signs of peritonitis or inflammation and infection of the abdominal cavity, characterized as a hard, rigid abdomen with severe pain. Risk factors for colorectal cancer include lifestyle factors, as we will mention in the succeeding portions. However, what is more important to note is that genetics, family history, personal history, and age play a bigger role in the development of colorectal cancer. People with hereditary diseases including Lynch syndrome or non-familial adenomatous polyposis and familial adenomatous polyposis carry a much higher risk for developing cancer. Patients with a previous history of cancer or colonic polyps likewise have a much higher risk for cancer than the general population. Modifiable risk factors for development of cancer include high fat and low fiber diets, having a sedentary lifestyle, obesity, and smoking. All of the aforementioned factors are modifiable and hence can still be mitigated to decrease the risk for development of cancer. Hence, physicians have always advocated for a healthier lifestyle to decrease the chances for developing non-communicable diseases such as cancer. Diagnostic modalities to diagnose colorectal cancer involve the following, beginning from the least invasive to the most invasive. The least invasive tests are used to screen for presence of either occult blood or presence of cancer cells in the stools. Although not diagnostic of cancer, these tests may increase the healthcare provider's suspicion for a malignant process. The first test involves fecal occult blood test, which is used to detect traces of blood in the stool, which may be one of the earlier manifestations of the presence of colorectal cancer. Positive occult blood test will warrant further testing with more invasive methods, as we will mention in the succeeding portions. Other stool tests, although not as widely available as the fecal occult blood test, are similarly utilized to screen for the possibility of colorectal cancer. Fecal immunochemical testing will check for antibodies directed against blood in the stools, while the FIT DNA test will check for altered DNA found within the stool. Positive tests are likewise not diagnostic of cancer alone, but may warrant further investigation and higher suspicion for malignancy. Imaging procedures to visualize the colon and rectum include magnetic resonance imaging and computed tomography or CT scanning. These images will utilize magnetic imaging or a series of X-rays respectively to provide a detailed image of the colon and rectum. This test may aid in identifying lymph nodes to check for the spread or to present an image of the mass and its relation to adjacent structures within the body. In order to view the mass itself within the lumen of the colon or rectum, a colonoscopy may be employed. Direct visualization allows the healthcare providers to characterize the mass, confirm the presence of bleeding, and to determine an approximate location of the mass. Furthermore, colonoscopy may allow for the direct excision and biopsy of colonic polyps or mass to confirm the diagnosis of malignancy. Screening is generally indicated for the regular population with an average risk at age 45 or 50, depending on the local guidelines, until the age of 75 years. Those deemed as high risk for developing malignancy involve groups with predisposing comorbidities, including inflammatory bowel disease, family and personal history of cancer, and the presence of inheritable diseases such as the Lynch syndrome and familial adenomatous polyposis. In the Philippines, the recommendation of the Joint Philippine Society of Gastroenterology and Philippine Society of Digestive Endoscopy is to screen Filipino adults with average risk beginning at age 50 years old and above. Screening may be done earlier for those who are found to be at high risk for development of malignancy. For the general population, screening modalities include the protocol of scope, scan, and stool. Scoping using either flexible sigmoidoscopy and colonoscopy may be done every 5 to 10 years. CT scanning may be done as surveillance for every 5 years, while fecal occult blood testing may be done as frequently as annually to screen for colorectal pathologies. Treatment for colorectal cancer primarily involves two types: surgical or non-surgical. Surgical resection is usually reserved for either low-grade malignancies that can be excised, or for palliation of end-stage cancer to relieve immediate symptoms. For curative surgery, colectomy is usually employed. This type of procedure involves removal of the cancerous part of the colon and reconnecting both ends of the colon or rectum. This is done for patients who are adequately prepared prior to surgery. For patients who have unresectable tumors, or for those who are not adequately prepared for reconnection of the large intestines due to issues of nutrition, active infection, uncontrolled comorbidities, or presence of intestinal obstruction, another surgical option is through the use of colostomy. This procedure involves diverting the path of the colon to a colostomy bag that is connected to the outer abdomen of the patient, thereby bypassing the tumor or obstruction in the colon. For non-surgical options, systemic chemotherapy may be employed to stop or retard the growth of cancer cells, destroying fast-dividing cells of which cancer cells are primarily a part of. This is usually given through the oral or intravenous route. The problem with systemic chemotherapy is its lack of specificity in targeting cells, hence other fast-dividing cells including hair follicles are also affected. Unlike systemic chemotherapy, targeted therapy or immunotherapy uses specific biomarkers as targets for certain drugs to latch onto to efficiently neutralize cancer cells carrying the said biomarkers. The advantage here is that it has less numerous side effects compared to systemic therapy due to its specificity. Lastly, external beam radiation therapy utilizes multiple radiation beams that will converge on a single target to burn cancer cells in a specified area. This is done to not only burn cancer cells but also decrease the recurrence rates. For more information about our services, please visit the Chinese General Hospital and Medical Center website at cghmc.com.ph.